Hi, today we are going to be showing you how to administer and score the brief pain inventory. There is both a long version and a short version of this form, and today we will be looking at the short version. It is a 15-item self-reported assessment of pain. It assesses pain severity, treatment, and medication effects on one's pain, and most importantly for occupational therapists, is how pain impacts daily functioning. This is a very useful tool for occupational therapists as it can help you get a better understanding of your client's pain and how to target your intervention. There is a long version of the brief pain inventory, but we will not be showing you that today as it is only really used for research purposes. The short form of the brief pain inventory is more used within a clinical setting and helps OTs and other clinicians to inform their clinical reasoning. The brief pain inventory is a self-administered form, but can also be administered as an interview by a clinician. The short form only takes about 5 minutes to administer. We've created a case scenario that we will apply as an example, and we will discuss the proper ways to administer and score the brief pain inventory. While administering the brief pain inventory, it is important to explain to your client the purpose of the assessment, get informed consent, and ensure confidentiality of their results. If it is being self-administered, it is important to let your client know that they may ask questions if they need clarification. And it may be useful to have a pen and proper writing surface available for the client. Today we will look at an interview between a client and an OT student who was administering the brief pain inventory. The brief pain inventory is used within a clinical setting to assess clients' self-reported pain severity and interference on daily functioning. It can be used with a variety of different conditions, including cancer, osteoarthritis, chronic and acute pain, plus many others. It can also be used to compare changes in pain after intervention. There are many reasons why a clinician would want to use the brief pain inventory. First of all, it is not physically invasive to the client. It is written clearly and concisely in an easy way for the client to follow. It doesn't take much time to administer or score and is simple for clinicians to administer. Both copies of the assessment and the manual can be easily accessed online for free, and this is a great advantage for clinicians. It also requires little equipment and no training to score or administer. It has excellent test-retest reliability in regards to pain severity and interference of pain in a person's life for individuals with various conditions, including chronic pain. Though there is no evidence for content validity, it was shown to have excellent construct validity and criterion validity. There are many studies that show it is effective for use with cancer patients. It is also effective with clients with post-operative pain, with chronic pain conditions such as osteoarthritis and low back pain. The brief pain inventory has good criterion validity as evident by good correlations with the Roland Morris Disability Questionnaire, which measures interference of pain with daily life and its intensity. However, this measure is the only one the brief pain inventory has been rated against. The manual provides specific instructions for administration and scoring. However, there is no normative data available. This is to be expected for this type of scale, since it is a subjective measure and pain level is not standardized throughout various types of clients. We are now going to show you how to properly administer and score the brief pain inventory. To properly do this, we have provided a case study to further your learning of application and use of the brief pain inventory within a clinical setting. We will also look at how this information can be used to inform one's clinical reasoning. The following case scenario is of Jamie. Jamie is a single mom with 2 young kids who developed chronic low back pain after a slip and fall over a year ago. She worked as a secretary part-time and is feeling pressured to return to work.
Hi Jamie, my name is Lauren. I'm a student occupational therapist. How have things been going?
Well, it's been really hard since my fall back in December. I've had a lot of lower back pain. It's really hard for me to do the laundry or get dressed. Even playing with my kids is really hard. And I haven't been able to go back to work as a secretary.
Okay. So what I was thinking we'd do today is we would talk some more about how the pain's been impacting your life, such as getting back to work and laundry, as you mentioned. And we'll also complete this brief pain inventory, which is just a short form that you will fill out yourself, and the results will remain completely confidential with me and with the healthcare team. Is that okay with you?
Yeah.
Okay, so just go ahead and fill this out and just follow the instructions. And if you have any questions, please let me know.
Okay.
There is no standard way to score this assessment, but it can be used to compare changes in pain after intervention. Clinicians, however, can take the mean of items 3 to 6 to get a pain severity score. As you can see in this example, the average pain severity is about a 5. Question 2 also gives you some good visual evidence of where your client's pain is located. Question 7 regarding medication management can give you a good indication of how effective their current pain management strategies are. It would also be useful to find out what medications they are currently taking to reduce their pain. You could also take the mean score of items 8A to G to get a pain interference score. As well, items could be looked at individually to inform your clinical reasoning. As you can see in this example, the client rated an overall average of about 5 for pain interference.
So I've gone over your results of the brief pain inventory that you filled out, and I see here that you've rated pain severity as about a 5 on average, and you've rated how much pain is interfering with your daily life also at around a 5 on average. I can see here specifically that you've rated that pain has been interfering with your normal work, which includes both work outside the home and housework as well. And you've rated that at an 8 on a scale of 0 to 10, 10 being completely interferes and 0 being does not interfere. So could you tell me a bit more about that, like about how the pain has been interfering with your work?
Yeah, well, I haven't gone back to work yet. I've been off work. I was a secretary before my fall in December, and I haven't gone back, and I've been really stressed about that because my boss really wants me to go back.
Right.
I've also had a lot of trouble doing the laundry. The washing machine is actually downstairs, so bringing all the laundry up has been an issue.
Okay.
Also dressing.
Oh, okay.
Yeah, I can't, it's hard for me to bend down.
Yeah. Okay, we can definitely work on some strategies for that. I also see that you've rated your enjoyment of life quite at a 6, which means that your pain has been greatly interfering with your enjoyment of life. So are there any other specific areas that we haven't touched on?
Playing with my kids. I have 2 young kids, and it's
Okay.
been really hard to even get down to their level.
Okay.
And they still want to be picked up, so that's been really hard.
So overall, the client identified the following occupational performance issues: difficulty dressing her lower body, difficulty playing with their kids due to pain when sitting on the floor at her children's level for prolonged periods of time, as well as getting up from the floor. She has increased pain when doing laundry, especially bending down and bringing the clothes up the stairs. As well, she is having difficulty sitting for long periods of time at her job as a secretary. The research supports a biopsychosocial approach to low back rehabilitation. Based on a literature review of occupational therapy recommendations for low back pain, evidence-based practice includes educating clients on proper body mechanics, grading functional activity including return to work, work reconditioning, and on-site interventions, environmental modifications at work, site visits, and ergonomic modifications, as well as cognitive behavioral strategies, positive reinforcement, progressive relaxation, and biofeedback techniques.
I can imagine that must have been really difficult. But what we can do is next session we can work on body mechanics, which I can teach you how to be aware of your body and its movement to help you avoid movements that increase your pain. And with your permission, I could also conduct an assessment of your home to see how you're doing in your daily tasks and identify where the challenges are. So you mentioned you've been wanting to get back to work, so I can speak with your employer about maybe getting you back gradually, like part-time or whatever works for you. And I can work on some stress reduction strategies. And you mentioned you were having difficulties with dressing, so to minimize your pain with that, I can recommend some tools. I will also teach you some pacing and energy conservation strategies. And I know this seems like a lot, but we can work on these things one by one and at a pace that works for you. Does that sound okay?
Yeah, that sounds great.
Great. I'll see you next week at 2 o'clock.
Okay.
Great.
In summary, the Brief Pain Inventory is a useful tool for individuals experiencing pain, and overall it has good to excellent validity and reliability. It is suitable for detecting chronic pain in pain clinics, acute care hospitals, and family practices. This tool is useful in occupational therapy because it focuses on the impact of pain on daily functioning, and it can also be useful as a comparative measure pre- and post-intervention to assess pain management outcomes.